Cystoscopy is a very commonly done basic urology endoscopy procedure. It is done under general anesthesia, but it is equally possible to do under local anesthesia also. And through this video, I would like to demonstrate to you how to do it under local anesthesia. Prior to cystoscopy, you will be required to give pre-medication to your patient. And in pre-medication, about 10-15 minutes before the procedure, I suggest that you give patient injection diclofenac. If there is a problem in diclofenac like a known hypersensitivity or a patient of uncontrolled diabetes or renal failure or extremes of age, for such reasons when you don't want to give diclofenac, that's a different matter. But otherwise, you can give injection diclofenac about 15 minutes before. It's a very good analgesia. And you have to give a parenteral antibiotic injection. If patient has a positive culture, then you may have to give antibiotic for longer duration. But if it is sterile urinary tract, you can be okay with one single injection prior to cystoscopy. I usually avoid giving my patients narcotic analgesia because it sedates the patient for longer duration. And then sometimes they start having MSS, vomiting, and that complicates the patient recovery after cystoscopy. So my personal feeling is to use only injection diclofenac and a shot of antibiotic in pre-cystoscopic medication. Hello Mr. Verma, good morning.
Good morning.
I shall be doing on you a test called cystoscopy. In this procedure, first of all, we will place you on the OT table and clean your genital area. And then we will put some drug in the urinary passage to anesthetize the urinary passage. And after that, once your urinary passage is anesthetized, we will put a rigid lens system inside the urinary passage to examine for any disease inside the urinary passage or urinary bladder, and then we will see what's wrong inside the bladder. During the procedure, you will feel as if you want to pass urine, because we will be using irrigation fluid to inflate the bladder, your urinary bladder. You will have a feeling as if you want to pass urine. When you have that feeling, let me know. I'll stop the irrigation fluid, drain the bladder, and the feeling will disappear. Another thing is that during the procedure, I might ask you to take deep breath, right? Take a deep breath in, take a deep breath out. Okay? So just bear with me, take deep breath in and deep breath out. I might also ask you to relax your thigh muscles and abdominal muscles and feel comfortable. So you will need to cooperate with me during the test. I can rest assure you there will be no pain, no discomfort and no problem. Right?